mynews.studio.
Imagine this. A $2 billion check arrives at a cancer institute's doorstep. What could that mean for people facing cancer now and in the future?
Today's date is 2025-08-23. Phil Knight, Nike's co-founder, and his wife Penny have just pledged $2 billion to the Knight Cancer Institute at Oregon Health and Science University. Let's break down what this really means. Where does all that money actually end up?
That's the big question, isn't it? This isn't just about keeping the lights on. The aim is to speed up early cancer detection, invest in precision medicine, and expand patient care. The focus is right at the beginning, catching cancer before symptoms even appear.
So in practice, we're talking new technology. The Institute already developed blood tests for early detection and treatments for leukemia, like Gleevec. Is this funding going to build on those advances?
Yes, exactly. This money will drive research into molecular characterization and systems biology, basically figuring out the earliest signals of cancer. It's like mapping out the landscape before any signs show up. The better the map, the sooner doctors can step in.
And it's not just about spotting cancer early, right? There's also talk about tracking tumors in real time and matching treatments to a patient's specific cancer genetics. Is this where the donation really moves the needle?
That's the hope. By understanding each patient's unique cancer profile, doctors can move away from one-size-fits-all treatments. That means less toxicity and more targeted results. Plus, clinical trials can happen faster with more resources, so new therapies might reach patients sooner.
But this isn't just about one institute. Does a $2 billion donation set a new bar for medical philanthropy?
It does. This is among the largest gifts ever made to medical research. It could encourage other donors or organizations to follow suit. And, given that public research funding can be unpredictable, private philanthropy like this can make a real difference, especially at this scale.
You mentioned a new model. The Knight Cancer Institute will operate as a self-governing entity. Is that common in this field?
It's pretty rare. Their plan is to bring research, patient care, and outreach together under one structure. If it works, it could become a model for other places and possibly even influence how governments support research.
What about partnerships? Does this kind of high-profile gift speed up collaboration between public and private sectors?
That's definitely the expectation. When donations are this visible, they can renew calls for steady government funding and prompt new partnerships. If the approach works here, it could lead to more focus on early detection and precision medicine, not just in Oregon, but elsewhere too.
So, to bring it back to the basics, cancer is still one of the top causes of death worldwide. Do you think this donation could make a difference for patients outside the U.S. as well?
It has that potential. Accelerating research, widening access, and encouraging others to donate, those things can create a ripple effect. The hope is that discoveries made here will eventually help patients everywhere with earlier diagnoses and better treatments.
So, bottom line, $2 billion isn't just a headline. It's a serious investment in innovation and collaboration aimed at speeding up progress against cancer.
That's really what this moment is about. One donation that could change cancer care, inspire others to act, and maybe one day help make early detection the norm.
Thanks for joining us as we explored what this could mean for the future of cancer research.
Thank you for listening. This episode was brought to you by mynews.studio. Try it free today.